Hi everyone, I'm Dr. Greenberg. I'm a cardiologist here in Colorado Springs. I've been in town since 1976, starting out my cardiology career at Fort Carson Army Hospital, and then starting my practice in cardiology as a group of one in 1978. It's been a pleasure being here, and now I'm working at Kaiser Permanente, finishing my practice in cardiology here within the next year. So looking forward to talking to you about cardiovascular health and what we can do to make it better. So what is cardiac health? Basically, cardiac health refers to the ability of your heart, lungs, and vessels to oxygenate, nutrition blood, and trying to pump the blood to the body so the body can respond to a good performance of the heart and then do the things that you want to do. So our goal is to try and make it so your heart functions well so you can perform and do the things you want without any cardiac restrictions. When we look here at this picture, you can see two sides of the heart. The one on the right is called the left side of the heart, and the one on the left is called the right side of the heart. And what the difference is that the right side of the heart pumps blue blood to the lungs, and after the blood goes to the lungs and gets oxygenated, then the blood comes back to the left side of the heart, and the left side of the heart pumps the blood to the body and to the tissues of the body so we can live and function normally. So the two sides of the heart are very important. The most important is the left side because it's the one that pumps the blood to the body, and so you can function in a normal sort of way. So we really do the best that we can to compensate and make the left side of the heart pump really, really well. And unfortunately for people who have heart attacks, the majority of heart attacks involve the left side of the heart, not the right side of the heart. But lung disease, if you're a big smoker, is going to involve the right side of the heart and make it so it doesn't function as well as it should. So the two sides of the heart are very important. We have to add them together, okay? And then the blood flow that goes to the surface, that's on the surface of the heart, but not inside the heart, but on the surface of the heart, those are the arteries that pump the blood so the heart functions normally, and those are the arteries that are involved when you have a heart attack. And what is cardiac disease? Well, there's all different kinds of cardiac disease. Okay, the ones at the bottom we're not going to be talking about today. Rhythm abnormalities to the heart, problems with the heart muscle, congestive heart failure due to weakening of the heart performance. These are diseases that are very common, but they're not nearly as common as coronary artery disease or hardening of the arteries to the heart, which is probably the most common disease that we take care of as cardiologists. And it is the disease that kills 50% of Americans. And so if we can get this coronary artery disease that causes heart attacks and coronary plaque formation, if we can decrease that disease, then we're going to make a tremendous input on prolonging people's lives, improving the quality of life. And one of my favorite lectures that I give is that as we get older and as we get towards the end of our days, the most important thing that we can do is that we want to add life to our days. We want to make the quality of our life as good as we possibly can as our time runs out. And so when we look at heart disease, the causes of coronary artery disease and the causes of the disease that we'll talk about, there are all different varieties. They could be, and one of the main problems that you have is it could be just a gift that mom and dad gave you, and you can't do much about it. Although they are genetic and environmental influences, the vast majority of the disease is a result of lifestyle change. But the one disease that is not lifestyle is when your mom and dad gives you a gift of very, very high cholesterol and very, very high plaque formation and incidence of coronary disease. And that disease only you can take care of and change the lifestyle. So the development of coronary disease is related to the development of plaque in these arteries that are on the surface of the heart. So if we look at the artery Okay, so this is the wall of the artery. This is where the blood flows inside the artery. And here is a patient who has just a tiny little orangey plaque inside the artery due to, usually the most common cause of that in our country is going to be related to cholesterol metabolism and cholesterol deposits inside the artery. Okay, so as the plaque starts to build up with time, and the causes, the things that increase the causes is lack of exercise, eating poorly, high blood pressure. These are the things, in addition to cholesterol, that starts to deposit plaque inside the artery. And not doing any activity and getting a little inflammation inside the plaque starts to make the plaques grow a little bit more over time. So here's a person whose plaque is on the inside wall of the artery, which is limited. Here's a plaque that you can see is about 30% of the obstruction to the arterial cavity, and the plaque grows and the lining of the artery gets damaged over time. And so this plaque can cause you to have some concern, but this plaque at a 30% blockage will never ever cause you to have a symptom of coronary disease. Like, here's a plaque. If you eliminate that picture there, here's a plaque that's 50% of the arterial opening. 50% plaque in your artery should allow you to perform all the activity that you want and cause you no symptoms whatsoever. So in patients that I see, typically, if they have symptoms, I'm assuming that the plaque inside their artery is at least 70% blocked. When it gets to be about a 70% blockage inside your arteries, without looking at that part of the picture, okay, then the symptoms that you usually would get would be coming on with activity, when you perform physical activity. In my case, when I run on my treadmill, okay, when I perform that physical activity, the symptom I would be getting would be a heaviness or a pressure or a tightness or an uncomfortable feeling in the chest that is provoked by performing the activity. If you then stop the performance and sit down and stop and just relax, the discomfort in your chest will disappear within around 5 or 10 minutes. So classical angina, heart pain, comes on with provocation, comes on with stress. When the stress stops and disappears, then the angina will disappear as well. The pain of a heart attack is exactly the same as the pain of angina. Two differences. Number one, the pain is much more intense, okay? And the difference between what the artery looks like, here's an artery that's 50%, 60% blocked, but then you have a clot forming on the artery because the plaque ruptured at this point right here. So when the plaque ruptured to cause a heart attack, then the clot formed on the artery, blocked off the entire wall of the artery, and so there was no blood flow going to that area of the heart. And when there was no blood flow, then you have damage to the heart, and the pain doesn't go away in 10 minutes. The pain is there for several hours. And the heart attack, different than the angina, comes whenever it wants to come, because the plaque ruptured, and it could rupture in the middle of the night and wake you up out of your sleep, because the plaque ruptured at 3 o'clock in the morning, and then the clot formed and obstructed the artery. So it can come at any time. But what are the risk factors? What are the things that cause you to develop this blockage in your arteries? Well, age could be one of them. It's much more common as you get older. The only thing is that you can't do anything about getting older except keep getting older. And your goal in life is to keep getting older, and the one thing you don't want to do is get old. Okay? And there's a big difference between getting older and getting old. Okay? So men are a little bit more common than women to have coronary heart disease, but I think there is more women developing the disease now than it has been in the past. So women are at risk as well as men, and again, you need to reduce the risk factors that you can. So there are 5 risk factors for coronary heart disease. The one that you can't do anything about is mom and dad and the gift that they gave you because they have higher risk of heart disease, or they do have heart disease, and their family had heart disease. So you can't do anything about mom and dad. So family history is one thing. The second risk factor for heart disease here on this list is elevated blood cholesterols. And so that was the gift that my mom and dad gave me. So what we have is total cholesterol and bad cholesterol and good cholesterol, and in addition to that we have a fourth cholesterol factor called triglycerides, which is usually related to high sugars and related to sugar content. And so the bad cholesterol now, the numbers have changed. The bad cholesterol, based on newer guidelines, has said that if your cholesterol is greater than 100, your bad cholesterol is greater than 100, then you are at increasing risk. Okay? So 100 is now considered mildly elevated cholesterol. And in people who have marked increase in risk factors, our goal is to get the bad cholesterol down below 70. So perfect is below 70, good is between 70 and 100. Okay? So if we can get you to 70 and 100, that would be great. So risk factors, cholesterol is a very high risk, and the other numbers, the good cholesterol, it's nice to have as high as you possibly can have it. The triglyceride is a number that's usually related to diabetes and can be related to high blood sugars and carbohydrate intake in your diet. So you want to get that down around 130 or below. Okay? So we talked about cholesterol. The next risk factor is hypertension, high blood pressure. The blood pressure guidelines have changed in the recent past. We're aiming to get your blood pressure now down below 120. It used to be getting you below 130. Now getting you below 120 is ideal. Good is below 130, but perfect is below 120. And anything above 130, we're going to start being more aggressive at trying to lower your high blood pressure. Things that you can do to lower your blood pressure: watch your salt intake, eat smart, and exercise. Okay? And the fifth risk factor, I believe, is going to be tobacco use. Smoking is good for me. I really enjoy smokers that help put my son through medical school and law school. But the one thing that smoking does for patients is that it increases your risk of severe lung disease and severely increases your risk of coronary heart disease. So anything you can do to reduce your risk is the treatment of choice. So 5 risk factors again: family history, high blood pressure, high cholesterol, cigarette smoking, and the 5th one is diabetes. And diabetes is a terrible risk factor. Do not get diabetes. That is the main reason not to become obese, because one of the most severe complications of obesity is the development of diabetes. And diabetes increases your risk of heart disease. It increases your risk of some abdominal diseases. It also increases your risk of kidney disease and kidney failure. So don't develop diabetes. So the last slide here is fighting cardiovascular disease with behavioral health. Life Simple 7 from the American Heart Association. What are the 7 things that you can do to reduce your risk of heart disease and specifically coronary heart disease? So the first one is don't smoke. Number 2 is maintain a healthy weight, basic metabolic index of under 30. Engage in regular physical activity. Walking is one of the best activities you can do for your heart. I either walk on the treadmill or ride a bicycle 6 to 7 days a week. I'm age 75. I do everything in my power to reduce my risk of having a cardiac event. So I eat a heart healthy diet. So things that are heart healthy, we're going to end up handing out some diet sheets for you. But things that you can do is watch the lipids, watch the fats in your diet. Not that you can't eat some fats, but eat less of them. So you should probably eat 25 to 30% of your calories should be fat calories. About 30-35% of your calories should be protein calories, and 45% to 60% of your calories should be carbohydrates. But again, you got to watch the carbs and watch the sweets, because that increases your risk of diabetes. So you got to be really careful with the carbs in your diet. Okay? Manage your blood pressure. 120 over 80 is the new healthy. 130 over 80 is the new level of everything above that is high. And so if you can stay 110 to 120 all your life, that would be perfect for you. Okay? Take charge of your cholesterol. We talked about that a little bit, about watching your LDL. And then the last is watching diabetes. Keep your blood sugar as healthy as you possibly can. And do not get diabetes. Do not get obese, because that's the #1 cause of diabetes in this country. Quick things that I just want to mention. Here is a test called the coronary calcium score. And in some people that is a reasonable test to come up with, just to give you an idea of how much calcium is in the plaques in your arteries. What it does not tell you is how severely the artery is blocked. It just tells you that you got calcium in your plaque, calcium in your artery, and if you do, then you have a plaque that's not normal, and it's got disease in the plaque. So in the right person, the coronary calcium score is a good thing to understand and to try and picture, do you have a problem? But it does not tell you the severity of the problem. It just tells you that you have some disease.
Thank you very much, Dr. Greenberg. That was some outstanding information, and I sure appreciate you spending some time today with the Phil Long family. And just thank you very, very much for your time.